This is Jody Lemieux, your host to the Spiritually Aligned CEO podcast, and you're listening to Conversations with Jody, your one divine guidance system, giving your mindset and business a spiritual facelift by tapping into energy, gaining inspiration, and up-leveling your life by unleashing your infinite potential. On today's episode, I have with me Dr. Manna Semby. Dr. Manna, thank you so much for joining me today.
Thank you so much for having me.
And so today's conversation is going to be about menopause and brain health. And I would love for you to give a description as to what you're offering people.
Sure. Thank you, Jody. This is a wonderful opportunity to talk to so many of your guests about the importance of the conversation around menopause. Every woman is going to go through it, is going through it, or has experienced it already. But I find that women are very hesitant to talk about this topic. Most women go into menopause without any guidance. Nobody tells us what to expect. Nobody tells us how best to manage, what to look out for. And we kind of just stumble through this whole process. And for some of us, actually, for most of us, this can be painful, difficult. We have heard of symptoms like hot flashes, night sweats, weight changes. These are the common symptoms people normally talk about, but there is so much more that is not talked about. And so it's really important that we learn what to look out for. And then we know also that there is a way to manage the symptoms, manage this stage of our life such that we don't have to give up our lifestyle, our choices, our careers, our relationships. We don't need to give up on anything. We can continue doing what we want to do, continue to pursue our passions, and yet live life fully without being compromised.
So I love that you're bringing this up to the forefront because the typical conversation, as you have mentioned, is usually about the hot flashes, the night sweats. So what are some other symptoms that people aren't really bringing about in conversation that you would like to talk with the audience today about?
Yes, and thank you so much. I really love that we are going to dig into this a little bit more. So, the biggest thing that women should learn is that the biggest killer of women is actually heart disease. 20% of women in the United States will die from heart disease, and most women don't know that that is the biggest health challenge that they face. And what happens with menopause? Pretty quickly, with the loss of estrogen in our body, there is a 20% increase in plaque in the arteries, which means our risk for heart disease goes up significantly at menopause. Now, we know the statistics that before menopause, women are generally healthier, they have fewer health conditions. But right with menopause, a lot of things begin to surface as health challenges. So, certainly, heart disease is one of them. Then another thing we need to know very clearly is that women's brains are affected at menopause, such that now we know that diseases like Alzheimer's and dementia do not suddenly just occur in our 60s and 70s and 80s. The changes in our brain begin at menopause with the loss of hormones. So, super important for us to know the impact on our heart health, the impact on our brain health. Other things that we need to know about. With the loss of estrogen, our bone density decreases remarkably. So we become susceptible to osteopenia and osteoporosis. So bone fractures become a big risk for us. Um, Other things like vulvovaginal health. It's generally known that women will lose elasticity in the vulvovaginal area. We lose collagen, we lose elastin. Sex becomes painful. We begin to get bladder infections or UTIs due to the loss of these hormones. So it's such a big picture of what happens, yet we have a very small window into what is the actual symptom of menopause that we need to look into.
And so you bring up a really important topic of conversation. What if someone is experiencing some of these heart concerns, brain issues, all the other issues that you were addressing here today, what would be an indicator to say, oh, maybe it's something I'm going through menopause? What
Right.
would be your piece of advice to somebody that's in the midst of this right now?
Sure. So if you are in your 40s or your 50s and you are still cycling, but your cycles have become a little bit irregular, then you certainly know you've already started the journey of perimenopause, which can be from anywhere from a year, 2 years to up to 7 to 10 years. And that's when your ovaries are really trying hard to put out the amount of estrogen and progesterone needed for your body to cycle regularly, but it's struggling. So you may go 3 months without a period, you may go 6 months without a period, but then again, you still get it. And finally, menopause is defined as 1 year of no periods. That's when you're technically in menopause. Now, if you're going through your 40s and 50s and you're beginning to have symptoms of hot flashes, night sweats, and you're still cycling, certainly these are indications as perimenopause is upon you. And you need to take action. So, the first thing they need to do, the most important thing is make sure you're making time for yourself. Self care is super important all our lives, but certainly so much more in our 40s and 50s. Because at this time, we have so many balls in the air, we're managing so much. And the thing that we are doing the least of is self care. So, it's super important to give yourself the time and permission to get the rest you need, to get the sleep you need, to eat right, to work out. Um, Surround yourself with community, nurture your connections. So get all the nurturing you can from all of that. Right. So that's number one. Number two is make sure you are getting the right amount of supplements, the important things that we know all of us need. Make sure you're getting your vitamin D3 with K2. Make sure you're getting your omegas. Make sure you're eating a healthy diet with a lot of green vegetables, a lot of cruciferous vegetables, a lot of broccoli and cauliflower. These things naturally boost your estrogen in the body. Okay. And then finally, the thing to do is consult a practitioner who is menopause literate. Today, we have certified menopause practitioners that are doctors, functional medicine practitioners. They can help you. They can test the levels of your hormones. And it depends on what hormones will be tested based on what your symptoms are and where you are in your perimenopause/menopause journey. So we can test and we can see how low your hormones are. And after a pretty complete conversation with you, talking about your health history, your family history, your surgical history, then it may be decided that you're a candidate for hormone replacement therapy. Now, we always make sure to recommend bioidentical or body identical hormones, but these are some of the things that you would do. And don't forget to share your experiences with others. Talk to other women in your life, because I find that women just don't talk about this topic.
Oh, I love these great tips. So the first one is self care. And the second one is nurture your body. Know what your
Yes.
body needs for food and nourishment and
Yes.
supplements and vitamins during this time. The third one is consult your practitioner. And then the
Correct.
fourth one is so key important. Have this conversation, share with others what you're experiencing, because once you start talking, I'm sure other women in your life may be experiencing something similar or know that, yes, they are the ones that are experiencing it as well. And then you feel like you have somebody that you can share this with. And so to know that you're not alone.
Certainly not alone. And also, I think it's really is our responsibility to teach women that are younger than us, women that are coming after us, or women that are older that are still cycling and don't know what to expect when they actually go through that phase. So it really, I would love for this to become an open topic of conversation, not only amongst women, but in society, because this is not something to be hidden. This is not something to be ashamed of. Somehow, the word menopause has become associated with liability and baggage and negativity, and it doesn't have to be. It doesn't have to be that at all. So I would love for us to start to really examine our relationship with this word.
And so share a little bit about your personal story of how you got into this connection between the menopause and the brain health.
Yes. So, okay. So to answer that, I will just say that we know now um, that for women, the master regulator in our brain is actually estrogen. So when we are having hot flashes, it is our brain's way of telling us that you are very low on estrogen and to please replenish that. The temperature control center in our body is in the brain. So when we're having hot flashes, it's the brain signaling to us that we need to get our estrogen back to levels that are helpful for our various organs in the body. We also have to remember that pretty much every cell in our body has hormone receptors, which means that every cell in our body functions better when we have these hormones on board. So, and in about 1993, did we come to know that the hormone estrogen is so important for women's brains. We didn't know. It's only about 30 years old, and this information has still not filtered down to all levels of our population. So that's simply a fact that we know how important estrogen is for brain health, and we lose estrogen at menopause, thus the connection between menopause and brain, right? And also, for me, what happened was, even though I went to naturopathic medical school, I studied gynecology, I studied hormones, but when it was my own time, when I was going through perimenopause and menopause, I didn't, it didn't strike me that, wait, I need to take action. I need to do something about it. And growing up, nobody had talked to me about menopause. It was something that was never talked about. I have older sisters, they never said a word. Older friends, aunts, other relatives, nobody said a word to me about menopause. And so when I was going through perimenopause, and it was a fairly quick perimenopause, um, I was at the time preparing for, to graduate naturopathic medical school, which is my second career. And I had started working when I went through perimenopause, and I was commuting long hours, working really full days. I have two teenage boys. I'm a single mom. Um, and I was burnt out. And I thought, like, oh my gosh, there is so much I need to do. I just don't have the energy to do everything that I need to do. But my life is so full. How am I going to manage? So I struggled with that for a while. And I don't know how many people are aware of the concept of heart rate variability. It's a very important metric that we like to use to check how healthy your heart is, how resilient you are overall. So, the higher the number of HRV, generally it's understood that the healthier you are. Around this time, when I was feeling burnt out at work, I was testing a system of measuring HRV at work to see how we could roll it out to patients at the clinic. And when my own HRV was tested, it was 3, which is like near dead. Like, you can only go down to 0. When you're healthy, when people are healthy and they're resilient, the numbers can be in their 50s, 60s, 70s, 80s. Mine was 3. So
Wow.
it was an objective confirmation of how burnt out I was, but I still didn't know. Like, I couldn't just quit work. I couldn't stop taking care of my kids. I couldn't, so many things I couldn't stop. So then, the owner of the clinic where I worked, I talked to her and I said, I think I'm going to need to take a break. I need time off because I'm so exhausted. And she told me that, are you on hormones? Because I know you've gone through menopause recently. I said, I'm not. So she put me on hormones the very same day. And things didn't turn around for me magically because I think I had put myself so deep down into this hole of burnout. It still took me time. I still had to take some time off to recover and recuperate. But little by little, my health, my resilience did come back. My hot flashes went away. Gosh, those were terrible. And my energy came back, and I realized how important it is to have hormones in our body, but not only be on hormones, but be on the right dosage of hormones. So I had to figure out what was the right dosage for me. I also had to figure out what is the right combination, because it's not just one hormone, it is at least 2 and perhaps 3. So it's estrogen and progesterone. So you have to figure out what is the combination of the two that you require. And do you also need a third hormone, which is testosterone? So that is evaluated on each person's case basis. So it took me time to figure out what is the right level for me. And then I was back in my life. I came back to work. I came back to being able to do pretty much everything. And yet there was something else going on in my body and in my life. I was diagnosed with breast cancer sometime after I started hormones. Now, the problem with hormone therapy is that the fear or the association between hormones and breast cancer is so high. There is this association, but it's a false association. And so I did a lot of research into this because I was at this stage diagnosed with breast cancer, had started hormone therapy not too long ago, and it would have been reasonable for me to think that it's the hormones. I started the hormones and I got diagnosed with breast cancer. But you see, the thing was that because I had studied oncology, naturopathic oncology in school, I knew that something like cancer doesn't just happen overnight. It also doesn't just happen in 6 months or a year. This thing is we have cancer cells in our body all the time, right? But our body is generally able to get rid of them in its normal way of detoxing and apoptosis. And so there is a constant surveillance that our immune system is doing to get rid of these cells. There are factors, so many factors that can happen that can lead to your body not being able to do this surveillance anymore, and you get diagnosed with a form of cancer. So that's what happened with me. And of course, my oncologist and my surgeon and everybody tried to get me off the hormones. Now, the breast cancer is a very interesting thing because it can be hormone positive and it can be hormone negative. If it is hormone negative, you kind of have a clear path that if you're taking hormones, well, at least it's hormone negative, so it's not going to directly impact your cancer. But if it is hormone positive, then it can create a real confusion for the patient and for the doctor. It's like we know that the hormones that we take, the bioidentical hormones, do not affect breast cancer hormone positive status, but the fear and the association is there such that even the oncologists that are on board with hormone replacement for hormone positive cancer, they will say, let's do low dose hormones. They'll go to low dosing just because of this association, even though it has been shown that if you are on hormones, your likelihood of getting breast cancer is 23% lesser than the population that's not taking hormones. And if you are on hormones, your prognosis is 40% better than somebody not on hormones. So it was a bit of a challenge for me to kind of see, like, do I want to stay on it? And I'll tell you, Jody, that there are so many things in my life that I have been unclear on, right? Like I've suffered, like saying, I don't know how to do this, or I don't know what is the right way about this. But with the hormones, for me, it was so clear that this is the right path for me. It was so clear. So I never went off of hormones while I was going through chemo, while I did surgery, when I went through radiation. What did happen though was that when I went through a month of radiation, um, I felt shortly afterwards, I felt that my brain didn't have the ability to think. Like I couldn't form thoughts. It was like an empty brain. And I had these symptoms for a couple of days in a row. And that is what was scary, right? That was scary to me. To me, that felt like this is what early onset dementia must feel like. Because suddenly you are sitting there and you just don't have anything in you, nothing. And I was still on hormones, and it is my speculation that the radiation probably zapped out all the hormone receptors in my body, such that even though I was taking hormones, it was as if I wasn't, because my body wasn't able to absorb them. So by myself, I doubled and tripled the amount of hormones that I was taking at that time. And sure enough, within a few days, my brain came back, and I haven't felt the same since then. I do know that a lot of women that go through menopause will complain of memory loss, will complain of brain fog, will say, I just can't remember things. Well, part of that could be, I mean, we say I'm getting older, people are getting senile, I can't remember things anymore. But I would urge women not to take this symptom lightly. If you're experiencing consistent memory loss, don't take it lightly. So that's what happened with me with the menopause and with brain health. And so I became such a passionate advocate for talking about these things.
Oh, you are bringing such valuable and very important information for women. I'm so grateful that you're joining me today because it's just such an important topic to be talking about. And like you said, not many people are talking about it. So, what are you doing today to help women in this part of their life?
So what I'm doing a lot of is talking a lot. I'm doing webinars. I'm talking to women in person. I'm talking to women in small groups. I'm also talking to a lot of men because one of the first few conversations I had was with this man about menopause. And he is a middle-aged man. He has 4 daughters, and he was like just taking all this information in and realizing how important it is for his wife and his daughters to know this information, right? So it's important to talk to women, it's important to talk to men, it's important to just talk about this topic in general. So, what I'm doing is doing my share to raise awareness. And I'm always looking for women that are in positions of decision making ability in organizations, in nonprofit organizations, in membership organizations, where I might get the opportunity to talk to many women at one go, right? So, a lot of this is just raising awareness, right? A lot of this is just talking to people like yourself, talking to my friends, to my sisters, to pretty much anybody, any networking that I do. I always bring up this topic and I say, this is what I'm passionate about. I want to talk about this. So that's one thing that I'm doing. And then, of course, my clinic is all based around menopause and brain health. So I see a lot of women in my practice and I work with them on optimizing their hormones. And then I do this whole exhaustive set of testing, before and after testing, to check where they're at with their brain health and with their overall health. Because for brain health, we can do MRIs and other scans, but by the time you are wanting to go for an MRI, it's already, in my books, a little too late. By the time somebody is diagnosed with mild cognitive impairment, MCI, it's like saying, and Dr. Bredesen, who is a neurologist, and I admire his work a lot, he likes to say this, that saying MCI is mild cognitive impairment is mild is like saying you have mild stage 4 metastatic cancer. There is no such thing. It is an oxymoron to say mild cognitive impairment is mild. So by that time, the brain tissue has already changed significantly, such that reversing those becomes difficult, not impossible. you know my second job working at a clinic was with patients with Alzheimer's, working to reverse their conditions, right? But more often than not, somebody has to do the work for them. There has to be a caregiver who's working with them and working on their food and working on their supplementing and working on their exercising. And so the person themselves is not in a position to make those changes that are required. So, my passion is to raise awareness to prevent dementia instead of going and then reversing it. It's like climbing uphill with a big load on your back, trying to reverse a condition like that. So, my passion is to tell women we know dementia is preventable. We know it is preventable largely, like I would say 90% of dementia is preventable. Okay, so we can change the statistics. We can change the lives of men and women. See, what happens is when we are in our 40s, 50s, and 60s, the thought of dementia is so far from us because we see our parents in the 80s diagnosed with dementia and we say, oh, that's something that happens in the 80s. But just imagine yourself being 80, your body is relatively healthy, but you're losing this ability to think, your ability to remember, your ability to connect, to me, that is way scarier than cancer, right?
Yeah.
So I see patients in my clinic. I talk about this. Um, those are the two main things that I do where I try and work on these two areas as much as I can.
This is incredible work. How can people reach out to you to
Sure.
find out more
So
about your research and what you're doing, and maybe have you highlighted on their show or their networking group or a nonprofit? How can they reach out to you?
I have a website and it's Aruna. The name is Aruna, Aruna, Aruna Med, MED. So just simply arunamed.com. And all my contact information is there, my phone number, my email. It's simply hello@arunamed.com. It's easy to find me and reach me. And I would love to hear from anybody that has any questions, wants to connect. Um, and one other thing that I would like to mention, Jody, is that for me, the time of menopause, this stage of menopause, ended up being what I call a metamorphosis for me. And I would love it if we could, um, if more women would be open to the possibility of this stage of life, this time of 40s, 50s, not being something to slow down, but to grow more into who you want to be and be more of yourself. And it's entirely possible. And any baggage with the word menopause, we can shed it. We can choose a new name if we want. So don't let it stop you, is my thing. Like, you just keep going, get the help, and talk to others about it.
Thank you so much for joining me today and sharing your wisdom and information and getting the word out about menopause and the connection to brain health. Thank you again. Is there any last parting messages that you'd like to share with us?
Um, I will say this, that whatever we may want to associate with menopause, that it's a pain, we don't want to deal with it. It's important to understand what it really is physiologically in our body. Menopause is a long-term deficiency of hormones. Period. That's it. It's anything else that we associate with this word is a story. What it really is in our body is a long-term deficiency of hormones, and if we give our body the hormones that it needs to function well, then sky is the limit. We don't need to let anything stop us. So to me, hormone replacement is a human right. I think all women should be offered hormone replacement, of course, after assessment of what is right for them. And I wish that every woman would find a practitioner who has the knowledge and the expertise to help them.